Parkinson's disease and hospitalization. As a board-certified internist and neurologist, fellowship-trained in movement disorders and neurocritical care, and working as a neurohospitalist and in clinic, I see this problem all the time. The goal is simple. Avoid missed Parkinson's medications, avoid harmful medications, prevent confusion, prevent weakness, and get you safely home. Number 1. Tell every provider that you have Parkinson's disease. Make sure the surgeon, hospital doctor, anesthesiologist, nurses, and pharmacists know. Do not assume everyone already knows. Number 2. Bring an accurate medication list. Bring a written list of all your Parkinson's medications, including the exact dose and exact time you take each medication at home. For Parkinson's disease, timing matters. 3 times a day is not enough. The hospital needs the exact schedule, for example, 7 a.m., 11 a.m., 3 p.m., and 7 p.m. Do not bring unlabeled pill boxes. If you bring medications, bring them in the original labeled bottles. Number 3. Do not stop levodopa or dopamine medications suddenly. Parkinson's medications should not be stopped abruptly. Missing or delaying levodopa can cause severe stiffness, slowness, tremor, trouble swallowing, confusion, and rarely a dangerous withdrawal-like syndrome similar to neuroleptic malignant syndrome. Parkinson's medications should be given on the same schedule as at home, as close to the usual time as possible. Number 4. Avoid medications that block dopamine. Some hospital medications can make Parkinson's symptoms much worse because they block dopamine. Blocking dopamine can make the patient more stiff, slow, shaky, confused, and harder to discharge. Nausea medications to avoid include metoclopramide, also called Reglans, prochlorperazine, also called compazine, and promethazine, also called Phenergan. Safer nausea options usually include ondansetron, also called Zofran. Trimethopenzimide, also called Tigen, may also be used when available. Domperidone is safer, but it's not routinely available in the United States. Number 5. Be careful with medications for confusion or agitation. Patients with advanced Parkinson's disease can become confused in the hospital. This can happen after surgery, infection, dehydration, poor sleep, pain medications, or missed Parkinson's medications. Some medications used to calm patients can make Parkinson's disease worse. Haldol, risperidone, olanzapine, and other strong dopamine-blocking antipsychotics should generally be avoided. If medication is truly needed, safer choices are usually quetiapine, also called Seroquel, pimavanserin, or clozapine. In the hospital, quetiapine is commonly used because it is practical and does not strongly block dopamine. Pimavanserin may not be immediately useful because it is often not available and takes time to work. Number 6. Get out of bed as soon as it is safe. Patients with Parkinson's disease can lose strength quickly in the hospital. Even 24 to 48 hours in bed can cause conditioning. Worse walking, higher fall risk, swallowing problems, constipation, and delayed discharge. If the hospitalization lasts more than 1 or 2 days, ask for physical therapy, occupational therapy, and speech therapy. Number 7. Have a plan if you cannot swallow or you are NPO. NPO means nothing by mouth. Sometimes patients cannot take pills by mouth because of surgery, nausea, bowel problems, or swallowing difficulty. If that happens, the medical team should not simply stop Parkinson's medications. They should contact neurology and make a plan. Options may include medication through a nasogastric tube, or a temporary dopamine patch such as rotigotine when oral medication is not possible. Number 8. Watch for swallowing problems, constipation, falls, and aspiration. Patients with Parkinson's disease are at higher risk for swallowing difficulty, aspiration pneumonia, constipation, urinary retention, falls, confusion, and medication side effects. If there is coughing while eating, choking, a wet voice, pneumonia, or new trouble swallowing, ask for a speech therapy. Swallow evaluation. If the patient is constipated, treat it early. Constipation can worsen medication absorption and Parkinson's symptoms. Number 9. Follow up after discharge. After hospitalization or surgery, Parkinson's symptoms may temporarily worsen. Sometimes medications need adjustment. Try to schedule follow-up with your Parkinson's specialist within 1 to 2 weeks after discharge, especially if there was confusion, medication changes, swallowing trouble, falls, or worsening mobility. Knowledge prevents complications. Please share, like, and subscribe. See you soon.